Nasal anatomy can be really difficult to understand and very difficult to explain, especially if you can't show it during real life surgery. However, not everybody wants to see real surgery. So after a trip to Michael's, I came up with this little diagram to help explain it. So come, let's take a look. So here's the shape of the typical nose. If we have the skin covering it, what we would see are the nostrils down here, the tip over here, and then the bridge of the nose. Kind of like this, coming in right between the eyes. Now, if you imagine that this is skin and we remove the skin, we see what the nose is really made of underneath. 3 essential parts. This top part here, the blue part, are the nasal bones. This is the only part of the nose that's actually made of bone. It's nice and rigid and it forms almost like a pyramid structure here. In the middle part, the green parts, they are very similar to the bones. They make up the side walls. However, these are very flexible. These are made of cartilage. And they also kind of float on the sides over here. They don't have as much of a support structure to the rest of the face. So you can even run your finger down your nose and feel where that transition point is from the hard bone up over here down into the softer cartilages over here. The 2 upper lateral cartilages rest in the middle, right here, on the septum. Now, the septum is another thing that's very misunderstood. It's the wall, a perpendicular wall, that runs between the 2 sides of the nose. So if we peel away these upper lateral cartilages, we can understand a little bit better what the septum is. Nice, flat, perpendicular wall. We can get into the different deviations and all that in another video, but essentially understanding that this wall comes all the way up and why it matters to us mostly during rhinoplasty surgeries, not just as a source of cartilage, which we can get from the bottom parts here, but because this part acts like a pillar. It supports these cartilages in the middle. So we have to really respect this part and make sure that we maintain good integrity and strength, especially the integrity and strength between the connections of these. If we work our way down, we see the lower lateral cartilages. These are almost like in the shape of an M, and there's 2 of them. Each lower lateral cartilage has 3 distinct parts: the medial crus, the intermediate or domal crus, and the lateral crus. We get into this in another video as far as what they mean, how they differ from person to person, and the great amount of variability, but at least understanding that this middle part is what supports the tip and its attachments to everything else. The intermediate or domal part is what actually makes up the tip. And if we have these lateral parts nice and flat over here, they're not going to create any excess bulbosity or fullness, but they're going to create the side wall down up along the nostril and help support the nostril. Again, we get into this in another video as far as the differences and how we change that, but hopefully this at least helps understand the essential structure of the nose with the bones nice rigid up over here, the upper lateral cartilages and the lower lateral cartilages down over here, as well as the septum being a nice flat structure in the center part of the nose, like that.